I'm a clinical investigator at Massachusetts General, and my main research focus is on cardiometabolic disease and HIV. And the reason that this is important is that individuals with HIV do have an increased risk of heart failure, and they also have an increased risk of atherosclerotic cardiovascular disease. My talk mainly focused on the first point of heart failure. And in women with HIV, this has been relatively understudied, and one of the mechanisms that we were looking into is myocardial steatosis, whereas we have increased intramyocardial lipid content. The reason that we looked at this process is that in people living with HIV, we know that they do deposit fat in different organ systems in a way that is pathogenic and also topic in fashion. And so that's the main reason why we decided to choose this population. So we recruited women from the general Boston community, and our main important factors when we were recruiting women was trying to match our groups based upon various factors that we know can affect diastolic function or even intramyocardial triglyceride content. So we recruited women with HIV and without HIV and matching them based upon age, their body mass index, history of hypertension, as well as their smoking status. And we excluded women who either had a history already of heart failure or other atherosclerotic cardiovascular disease or diabetes. We also excluded women who were on lipid-lowering agents or medications that were anti-inflammatory, things that potentially could affect our primary endpoints of intramyocardial lipid and also cardiac function. So in our study, we used MRI technology and MRS technology to evaluate cardiac function and intramyocardial lipid content among women with HIV and without HIV. And our primary endpoint was to look at intramyocardial triglyceride content, and we found that the women living with HIV had an increase in intramyocardial triglyceride content compared to women without HIV. And notably, we sought to see if there was any relationships between circulating triglyceride levels or body mass index, and there actually was no relationship among intramyocardial triglyceride content and these factors among the women living with HIV. And then the next thing we did was assess cardiac function through the cardiac MRI, and here we found that there was evidence of diastolic dysfunction among the women living with HIV. And probably the most important aspect of this is that we did find that there was an inverse relationship between the intramyocardial triglyceride content and diastolic function. So the higher the lipid content among the women living with HIV, the worse their cardiac function. Yeah, I think certainly there's a lot of clinical implications in our work, given that this population does have increased heart failure, and for heart failure with preserved ejection fraction, where there are no therapies that improve mortality, it's very imperative that we actually try to find the mechanisms of this disease process in women living with HIV. And so we're actually looking to do two studies. We're actually already recruiting patients for these. One of those studies involves statin therapy and seeing if statin therapy can improve heart function over time, as well as reduce myocardial steatosis. And the other research, which is more of a smaller pilot study, is looking at the role of tesamorelin, or growth hormone releasing hormone, which is known to reduce visceral adiposity in HIV, and seeing if this could actually reduce myocardial steatosis and improve cardiac function over time. So we're looking into two potential therapies for this.